After studying for 10 to 15 years, every medico deserves to have a good earning. So in this video, let's see which are the top earning medical specialties in India. And this is not anything vague, it is backed by stats. फर्स्टली मैंने वो काम किया जो तुम लोग सब करोगे कि चैट जीपीटी से पूछा कि कौन कौन सा स्ट्रीम में सबसे ज़्यादा अर्निंग का पोटेंशियल है एंड इट सेज न्यूरो सर्जरी 30 लाख टू 1 करोड़, कार्डियोलॉजी, देन आफ्टर दैट ऑर्थोपेडिक सर्जरी, oncology, intervention radiology, plastic and reconstructive surgery, neurology, gynae ops, pediatrics. I don't agree with this much, and dermatology. See, dermatology baseline they have given 6 lakh. It's lesser than the stipend you get during the PGC. So it is a bit surprising and doesn't seem to be much authentic. यूएस में क्या होता है ना, उन लोगों का एकदम फंडा सिंपल है, उन लोगों के पास स्टैट्स है कि विच आर द हाईएस्ट अर्निंग ब्रांचेस इन देयर कंट्री. So first is the neurosurgery, then is the interventional cardiology, then is the plastic surgery, then orthopedics, cardiology, gastroenterology, radiology, dermatology, anesthesiology. Like this, the list goes on. But this is for the US. It is a developed country and India is a developing country. So the demographics play a major role. Let's see the demography. This is the number of registered doctors is to the population. This is the ratio. National average has come to 811. See, this is so much surprising. WHO norm is 1 in 1000 population, but in India, it is 1 in 811. These are registered medical practitioners. It includes the MBBS, MD doctors and Ayush doctors also, because they are also in the market. They are going to see patients. They are also your competitors only. In this, the red areas, these are, I will say, better areas because they have more scope. There the saturation is lesser. So the better areas are the northeastern India, the central and northern India. Rest all, it is more or less saturated only. Focus on this graph. This is the population dynamics and the ratio of population from 0 to 14 years, 15 to 59 years and 60 years and above. This is the projection. Suppose a pediatrician was practicing in the year of 2011-12. That time the pediatric population ratio was 35%. But if you are taking pediatrics now, your peak practice will be in the 2040s and 50s. That time the population ratio will be dropped to 20%. Similarly, in 2020s, the 0 to 20 years age group, the population was 55 CR. But in 2040s it will be 44 CR. That is, the population in the pediatric range is reducing. The population in the middle age, it is remaining constant, and the population above 60 or 65 years, it is increasing. That is, the geriatric population is increasing and the pediatric population of India is reducing. Similarly, another thing stats you should see that in your state what is the saturation of your particular stream. Like I take example of my state, derma seats and Karnataka derma seats. In my state West Bengal there are 41 dermatology MD seats. In Karnataka it has 191 seats. The population in West Bengal is 10 cr and the population in Karnataka is 6 cr. The GDP also plays a role, that whether the patient is going to pay you high or whether they can afford the procedures that you are going to do or not. So GDP in West Bengal is $236 billion and that of Karnataka is $360 billion. Now see, the total fertility rate of India is also reducing. Total fertility rate of India at 2010 was 2.6, but in 2025 it is 1.9% and it is going to reduce further and further as the society is advancing and as the modernization is happening. So according to me, the declining streams are the pediatrics and the pediatric surgery. Why pediatrics and pediatric surgery? Because सब कुछ खेला डिमांड सप्लाई का होता है. If the demand is reducing and the supply is increasing, then the stream will be getting lesser pay. And if the demand is increasing and the supply is reducing, the streams are going to be paid higher. Here the demand is reducing, that is the population in pediatric age group is reducing, and the supply, that is the MD pediatric seat, is increasing. So this is an unhealthy situation. And pediatric surgery, because the antenatal care has become more and more advanced, you can detect the anomalies earlier, and there the preventive measures are also better nowadays due to the prenatal screening of all the infections and all. Evergreen streams, that is their demand will remain the same throughout the years. These are the general medicine, OBGY, radiology, chest medicine, rheumatology, orthopedics also, I missed it out, clinical dermatology, physical medicine and rehabilitation, general surgery, and all other streams. Which are the rising streams in nowadays? These are the neurosurgery, because the seats are also less and more accidents are taking place nowadays. Spine problems are occurring, so neurosurgery is going to increase. Interventional cardiology, India is the diabetic capital of the world, and more heart attacks are taking place, so interventional cardiology is going to boom. Intervention radiology also has very much less saturation, so it is going to boom. People are more concerned about their looks nowadays. So plastic surgery and cosmetology is also going to boom. The cancer sector, cancer is becoming more and more common due to the daily lifestyle, exposure to pollutants, and unhealthy living habits. So surgical, medical, radiation oncology is going to boom, and also the allied, the nuclear medicine is going to boom. Geriatric medicine is going to boom. Psychiatry, more and more psychiatric issues are occurring in the new generation, and the stigma is also reducing. With that, the de-addiction clinics are also going to boom. Reproductive medicine, very much it is going to rise. As I said, India is the diabetic capital of the world, so endocrinology is also going to rise. Gastroenterology also going to rise. Coming to branches with least saturation till now, the PG seats are not that much high. These are the neurosurgery, CTBS, nuclear medicine, and interventional radiology. Coming to which I think are the top branches that are going to earn havoc in the 2035 or 40 years when you are going to practice. These are the neurosurgery, orthopedics, it is a very much high earning branch all throughout India, OBGY, cardiology, interventional radiology, and psychiatry. Psychiatry I have kept at last because here you can't do procedures. For procedures you can charge more, but here only you can charge by consultations and therapy sessions. The most important point is that the income depends on you, not the branch solely. So what matters is the knowledge, your skills, your surgical hands, how you handle the patients, your communication skills, the saturation of doctors, where you are going to practice, the population of the area, the per capita income of the patients also, your publicity, and how much good is your setup. One thing that GRG sir says that potential बंदे में होता है branch में नहीं, I completely disagree with this fact. Potential बंदे में होता है and branch में भी होता है. See, if I take example of GRG sir also, then he is teaching pharmacology. He is in the education sector. In NEET PG, 20 questions come from pharmacology. So potential pharmacology subject में ज़्यादा है compared to the radiology or dermatology or orthopedics, जहाँ से खाली 5 questions आते हैं. So if you become a teacher in pharmacology anatomy, you have more potential than those who are becoming teacher of the short subject like eye, ENT, dermatology, radiology, anesthesia and all. So potential बंदे में भी होता है, branch में भी होता है, but don't run after money. See, if you are a person who likes surgery and you get the adrenaline rush saving the life of patients, you may not be satisfied doing radiology just because you got a good rank and people are saying that you should take radiology. And there is minimal patient interaction, and that may not help you to satisfy your urge of getting that adrenaline rush. So purpose is more important than the money. If you are good at something, if you are passionate about something, then money is automatically going to come. What is the purpose of your life? The purpose of your life is not to earn money. The purpose of your life is to stay happy. We all deserve happiness, and this is the main parameter from which success should be determined. Just money can't give you happiness. Your satisfaction also matters a lot. So go follow your passion. This is just a video to show you just what are the earning potentials of different branches. If you like the video, then do subscribe to my channel and do join my Telegram channel and WhatsApp channel also. The link is given in the description box below and pinned comment section. Now, if you are someone who has not yet decided your PG branch, now a video is there how to choose your PG branch. Go watch it now.